and I talk about this in the book. I think there's some very specific types of polio pain. There's a muscle pain, which tends to be deep and aching. There sometimes is a more superficial pain, which almost seems like it's on the skin, which is more of a burning pain. My feeling is very strongly that folks that have polio pain, I'm talking about the deep muscle pain and maybe the joint pain in weight-bearing joints, usually because the muscles supporting those joints have gotten weaker, that kind of pain is generally very treatable, but never with medication. So I'm an absolutist about that. If somebody comes in and says that their legs really hurt them when they, walk a long distance, since for some people a long distance would be a block, and for others it might be 5 blocks, or for some people it might just be around the house. But if there's a clear history that they've got muscle pain with weight bearing, with prolonged weight bearing,
stop bearing weight.
It's a no-brainer. It's a no-brainer. But you'd be surprised at the number of people who just struggle to find some way to stay on their feet. I understand where they're coming from, but on the other hand, if the pain is really, if it's bad enough, the old saying, pain is nature's way of telling you to slow down. And the same thing is true of weight-bearing joints. Or of your shoulders if you're pushing a wheelchair or lifting heavy objects for whatever reason. That's just a no-brainer. The difficulty is getting patients to accept it. So I think the worst thing you can do is give somebody strong pain medication to hide it, to cover it over, because you're not treating the problem, you're treating the symptom.
Okay. Would you be comfortable explaining how you manage your own condition? You don't have to.
Yeah.
So you started experiencing the first symptoms of post-polio at what age?
Well, it was...
Because you had polio at 18.
Right. So it was about 30 years later, so I must have been...
In your late 40s?
Yeah. It came on relatively quickly, over a period of several months. And as I mentioned, it wasn't the heavy legs that I felt first. The first thing was extreme fatigue, which I had never had before. All through college, through medical school, through 4 years of internship and residency, working every other night, every other weekend. Very, very intense, labor intense. But I was able to keep up with my colleagues, and I tended to have fairly intense jobs after that. I used to play a little tennis. I did some jogging. I was trying to stay in shape. I would jog upstairs.
I read in your book that you out leg wrestle.
Oh yeah.
Your wrestling colleague or whatever he did.
Soccer playing.
Yes.
Yeah, right. I was in college. My legs were very strong, and the thing is, I used my legs to sort of supplement my paralyzed right arm. So I would lift things with my legs. Anyway. I was driving home one day back in, I think, late 82, early 83, I'm not sure, and I stopped at a red light and I fell asleep. Never done that in my life. And I woke up pretty quickly. It wasn't a problem. But I realized that part of the day I was getting very tired, so on the way home I just pulled into a parking lot and I'd sleep for 10 minutes or something, and I was refreshed. So that was my first symptom. And of course, I had no idea what the hell was going on. And then the next thing I knew was I was feeling my legs were heavy when I walked long distances, 3-4 blocks, say, which I used to do multiple times a day, and I worked in a hospital and walked long corridors, no trouble. And then I started to get very, very intense leg pains in my thighs, which help stabilize your knees when you're standing. And
Were you taking painkillers?
No. But I had no idea what was going on. But as it turned out, I was working in a hospital that had been a polio respiratory center. Marcia Dimes helped pay for about 15 hospitals around the country. They were called respiratory centers. And some of them survived, and then they became just general rehab hospitals, and that was the case for this one in Houston, Texas. And there was a physical therapist from the polio days who worked there, older woman. And so I saw her one day, and I mentioned that I was getting these bad pains in my thighs. And she didn't know anything about post-polio syndrome. I mean, that term had not been coined. There was nothing in the literature about late effects of polio, with 1 or 2 exceptions. But she was just a savvy clinician, and she said, "You need a wheelchair." Or I think she said, "You need a scooter." Basically, get the hell off your legs. So I actually got one. I mean, pain really does cause you to change your behavior if it's severe enough. I got a scooter. It's the same one that's sitting out in the hall. 25 years old. And it still clunks along. But within 3 days, my pain was gone. And so what's happened over the years is, so then for a bunch of years, I was able to walk comfortably outside the hospital. And eventually, about 15 years ago, I was beginning to get problems just with, walking around the house, community walking. So I got another scooter and a van, which I have now. So I can load the scooter in the van and carry the scooter with me.
You lift it? You don't have a hoist?
Yeah.
Yep.
Yeah. And then more recently, I got the third scooter, which I have in the house, which I don't use too much right at the moment. But in any event, that's sort of, you see that sort of progression.
You don't have respiratory problems at all?
I don't.
Sleep apnea?
No, I've had 3 sleep studies. So I was in an iron lung, so I thought I'd be a candidate, and maybe in the future. But, So, I still, the distance I can walk comfortably gets, shorter and shorter, almost year by year. And, you're very tempted to, if you're feeling rested and your legs are feeling good, you go 10 steps, 20 steps, 50 steps more than you probably should. And then my legs start hurting. So, I'm still dealing with the same issue, but in a much different dimension than 25 years ago.
What do you do for exercise?
I'm one of those ones that doesn't have any muscle exercise. I do stretching. But my left arm is weak from the original polio, and it's getting a little weaker. And for me, walking around, the little bit I do is my leg exercise. That's it.